Well, the Health Minister Gillian Keegan joins me now. It's a question we put to a minister yesterday, but does the government know how many people are currently self-isolating?
Well, we don't actually collect that data on a daily basis, but it's obvious if you look at how many people tested positive yesterday, it's about 215,000, that they'll all be self-isolating, obviously, from the previous days. So it's about 1 million people probably are self-isolating right now.
Isn't this a figure that you should know, though? It seems that you're working on a load of assumptions and guesses.
No, we get the tested positive, and obviously we get those figures, so you can add those up over the days. But obviously what we don't know is how many people after day 6 and day 7 have tested negative and then are free to leave isolation. So it's around about 1 million people, though.
OK. Now, announced tomorrow by the Prime Minister, 100,000 tests for critical workers. How are they going to be distributed?
They will be distributed directly to the workplaces of those critical workers. So some of it will be via some hubs that they've set up, but they are being distributed. So it's a separate channel, separately, directly to those workplaces.
It seems quite a low figure, 100,000. How did you come up with that?
Well, they've worked with the sector to look at those that are absolutely critical workers. And what we'll be doing is delivering a daily test, a test every day. So they'll have packs, which will mean that every day that they're going to work, they'll be able to take that test. But of course, we also have mass testing available. We're one of the, well, I think we're testing more per head than any other country through the usual channels as well. And we actually had a record for home deliveries yesterday as well, with 741,000 testing kits that were sent to people's homes yesterday. So, you know, there are other channels as well, and lots of workers use those. But for NHS, social care, schools, and also now for this critical worker channels, we have separate channels.
Which sectors are actually going to fall into this category then? Because we spoke to the Road Haulage Association and they haven't been contacted by the government. They have no idea. Obviously, lorry drivers are pretty critical, aren't they? Are they going to be included?
It's fire, police, emergency services, I think border force, testing lab staff, obviously they're quite critical at the moment, food processing and some elements of transport, but not everybody in transport would be considered critical and would need to have this daily test delivered to them every day.
Why not? I mean, surely lorry drivers are pretty critical.
Well, because they can get tests very easily. Actually, most people, the main channel for most people is to get tests via the main channels, either booking to get something sent to your home or pharmacies. And I know there's been a couple of surges in demand which have meant that we have had, you know, a couple of times when they haven't been available, but we have ordered a lot of tests and we have 350 million which will be available in January and February. We've actually tripled our lateral flow testing capacity. That's one of the things we've been working on over the Christmas break.
There has been a real issue, haven't there? I mean, you know, anecdotally, there are people who have tested positive and are now waiting to go back to work, but they can't because they can't get the lateral flow test delivered to their homes. We know, as you say, these figures about all these large numbers that are being produced and shipped out, but some schools are reporting a 2-week delay in receiving kits. It's certainly not going smoothly at the moment, is it, in terms of getting it into people's homes right now?
Well, it's obviously difficult because of the surge in demand. And as I say, we're testing more per head than any other country in the world. But we did have a record day yesterday, 741,000. And we are tripling capacity for January and February. So hopefully that should ease up some of these sort of short-term difficulties we've had. But, you know, if you go on and you continue to go on the website, which I know is a bit of a pain, but if you do go back on, you will find that more come available within the day. And as I say, a record day yesterday, 741,000 kits were delivered to people's homes.
What about the wait for results as well? We know that that has been an issue. The Home Care Association says that some care workers are waiting over a week for PCR test results, so they can't come back to work. Mencap has reported an 8-day wait for some of its employees. What is the cause of this delay in the PCR results?
It's all surge in demand, actually, is what's caused some of this. I mean, obviously, you talked about some of the numbers with Omicron. I mean, there are a massive number of people coming forward at once, actually, to get those. So we have also looked to increase our PCR capacity as well. But really, it has been a surge in demand. We are dealing with unprecedented numbers, and obviously, we're getting back as soon as we possibly can. But as I say, we've set up a testing system, which is, you know, one of the most comprehensive in the world.
The PCR, you're saying we're setting back up. Did it close down over the Christmas and New Year period?
No. I said we've increased capacity. We're increasing capacity in the labs, in the PCR labs. It hasn't closed down at all, no.
Because the health workers and care workers are meant to be prioritised, aren't they?
Yes, they are prioritised. They have a separate channel and they are prioritised, both for lateral flow tests and for PCR tests.
Why is it taking so long then? You know, if the prioritised people are taking over a week, it doesn't sort of give much hope for the rest of us.
I don't think that's typical, actually. I mean, you will find some people are waiting too long, and that's why we've worked on increasing their capacity, but that's not typical. You wouldn't normally expect to wait a week for a PCR test response. And actually, now, more and more, the capacity will be being increased. And, you know, we, as I say, having more and more lateral flow tests as well, which people are using before they go out or before they go to work or before they go and meet family, elderly relatives. So they are being used very, very widely.
Despite all of this, the NHS seems to be overwhelmed at the moment. We've got a number of trusts with critical care status. The North East Ambulance Service has been reportedly telling some of its call handlers to tell people to just bring people in if they think they're having a heart attack, friends or family, instead of calling for an ambulance. The Royal College of Nursing has spoke about the fact that this is not hysteria, it's blowing the whistle on the situation. NHS Confederation says that the government's saying that we're coping, we're managing, it doesn't chime with the experience of the staff. Is the government giving a very different message than we're hearing at grassroots from those working in the health service?
No, I think what it's important for you and your viewers to understand is those local measures where somebody says they're in a critical state, they are actually part of the local contingency planning. And there's a lot of different levels to the contingency plan, including restricting some services for a period of time as well, which you've seen one or two of the hospitals have decided to do. And what that acts as is the start of an escalation process, which then calls in mutual aid, calls in additional staff. So they work with the local resilience forums, they work with their NHS regional staff to then put in place measures to help with that situation. And that's part of the contingency planning. And actually that happens every winter. These are very tried and tested plans. And it does happen
asking people to take their neighbours to hospital.
We know this winter they're going to be under extreme pressure. We know that.
What about the NHS North East Ambulance Service saying to people, look, you're not going to get an ambulance, just get your neighbour to bring you in if you think you're having a heart attack?
Well, that is not what we have put in place at all. So we have more ambulance crews in operation than we've ever had. We also gave £55 million extra just for this period to cover staff and make sure that we had increases in staff and staffing levels. And I've actually asked NHS England to look at that particular case because that doesn't sound to me like that is that's an acceptable approach. People should be able to get an ambulance if they have a heart attack, and that's why we've put that extra funding in place to make, and that's why we've been building up our ambulance service over the last couple of years.
The Prime Minister yesterday talked about riding out this latest wave of COVID, and it's clear from the data that Omicron isn't as serious in terms of mortality outcomes than other strains like Delta were. But there is, of course, the impact of long COVID, and we're now seeing, obviously it's taken a while for this data to come forward, analysis from America. Penn State's researchers found that more than half of those who had COVID-19 still had symptoms 6 months later. So do you think the government needs to perhaps take a step back and think again about its policy in that sense? Yes, large numbers of the population may not die, but could large numbers of the population be affected in the long term? And this could be an issue that we're storing up for the NHS in months and years to come.
Well, you hit on a conundrum, Jane, there, which is, could it? So we have actually got to act on the data that we have, and that's the decision that we've made this time. The most important thing that we've done is to build up this booster programme to make sure that everybody can get access to a booster as soon as possible. So if I could just use the time to urge everybody who hasn't to please come forward for one of those 2 million appointments this week, if you haven't already had one. But of course, there's been many things we haven't known. We didn't know at the beginning the severity of the data of the disease, and now we've had some good news on that. Of course, we don't know about this particular strain and the impacts longer term. We do know a bit about long COVID, which is why we've set up some long COVID clinics, and we are very concerned to make sure that we obviously take care of people who have long COVID. It is debilitating, but you know, there's so many unknowns that all we can do is act on the data that we have, because we have to be balanced and proportionate. We know it is not easy to lock down a country. We know it comes with costs and consequences to lives, to livelihoods, to life chances for children. It isn't an easy decision. It's not one to be taken lightly, and that's the balanced and proportionate approach that we've taken. But we have to act on the data we have.
On the data on boosters, as you did bring them up, why are there still 9 million people in the UK that haven't had their boosters? And I know that you're keen to bang on about all the availability of boosters, but only less than 20,000 people took up that offer on Saturday, just gone. Yes, you had some days in December with big numbers, but it's fallen off a cliff since then. Why have people stopped getting their booster, do you think? And why isn't the government doing more to get them in?
Well, we have a big programme of booster programme all across the country, so it's very convenient, it's very easy to get your booster. Well, I think there's probably a little bit of a bank holiday lag. Obviously, we're all just back now to work and school. But there is also probably another factor that I know in my own case, there's some people who are still having to wait out their 28 days because they actually have had COVID as well. So I would expect those people, there was a big surge of people that had COVID during December and over Christmas period, so they'll have to wait 28 days. So I suspect that's probably also having an impact on some people's ability to get the jab straight away. But we would urge everybody, if you're eligible, if you are within that 28 days if you've had COVID, please come forward, and please come forward. The quicker we can get everybody boosted, the better we can really be prepared to ride that wave that the Prime Minister talked about. It's one of the key parts of our defence, our wall of defence, and we're really relying on this as a national mission for everybody to come forward, please, to get their booster. Or if they haven't yet been vaccinated, to come forward and get their jab. We know they work and they make a massive difference.